In kids, we often see kids for hydroceles, which is a collection of fluid around the testicle. And in that population, hydroceles and hernias are really considered the same thing until proven otherwise. They're caused by a little opening from the groin down into the scrotum that's letting a little fluid down into that area to accumulate. In kids, these hydroceles are very common at birth, and a lot of them go away on their own in the first few months of life or within the first year. So often we monitor them. But when they show up later in life, the concern is that that little opening is now starting to get bigger and let material like fluid down into the scrotum. Over time, as the kid grows, that opening can get larger with them as they grow. And then other material can start to make its way down into the scrotum, like intestines or abdominal fat, which is not a good thing. I try to tell parents that these hernias are not caused by their 2-year-old helping somebody move and straining themselves and making the opening create itself. It's a structure that's part of normal development that's supposed to close up right after the child's born, but in some kids it doesn't. We really try to fix these when they are a smaller problem, when it's just fluid, oftentimes making its way down to the scrotum, or when it's an uncomplicated hernia with some intestines making their way in and out of the scrotum. With these hydroceles, we try to repair them when it's just a little bit of fluid coming down before that opening gets larger and turns into a bigger problem. A way that these hydroceles or hernias often present is that at the end of the day, the parent may be giving the child a bath and they see one side of the scrotum is swollen all of a sudden, but the child is happy and playful. They'll get evaluated by their pediatrician or by us, and we might feel fluid or a small hernia, and it needs to be repaired. In adults, hernias are very commonly repaired with mesh to reinforce the area because oftentimes the underlying issue is that somebody did overexert themselves, and that caused a defect in the abdominal wall, which is creating that bulging. In kids, this didn't happen because they strained themselves, so we don't use mesh. In kids, hernias are repaired really just by closing off that opening with a stitch, sometimes tightening up the fascia on the outside, and really that's it. Hernias that are very large and present in premature babies or babies that have risk factors for those hernias to happen, it is more likely for them to come back later on when they're older. When they're smaller openings caused by when there's smaller openings that are associated with a hydrocele, those are often not likely to come back.